What I see is about the Parkinson disease. When I was practicing for 30 or 40 years back, I hardly see a case of Parkinson disease. Now almost every week I see 1 or 2 cases. And even the younger age, 50s, 60s, we get Parkinson disease. Still we don't know exactly what the exact cause. In the brain, there is a dopamine enzyme is secreting that activates the nerve cells, that activate the whole body. But without no reason, the dopamine hormone getting reduced, so we get a lot of problems. What is the reason? Since we don't know the reason, there is no treatment also. There is no specific treatment. For example, the common problem, what I say is a tremor. This is very important, kindly note this. Tremor is the commonest early presentation of Parkinson's disease. But the tremor will be differentiated to the tremor due to the aging. That's where you are very important. Many people age 70, they get tremor. They say, oh, it is because of old age. At this age, I can expect some tremor. That is not so. So, tremor in old age is different from tremor due to the Parkinson's disease. Parkinson's is like this. Severe coarse tremor. What they say, thumb beating or pill rolling. Please remember these two very important points to differentiate from the tremor due to the aging, tremor due to Parkinson's disease. The very coarse tremor, thumb beating or pill rolling, that will be only at rest. At rest only you get the tremor. When you ask the patient to stretch your hand, this will disappear. This is Parkinson's disease. In contrast, in aging, they have tremor only in the action. That's all the action tremor. At rest, there won't be a tremor. When you ask them to put the hand like this, this is a fine tremor, action tremor. When you at rest, it will disappear. Easily you can differentiate. But many people, even Parkinson's disease, they say it is because of age. So they come in a very advanced stage where we can't do much. The earliest way differentiate is where the tremor is there, it is due to Parkinson's disease or aging, please differentiate. Another in Parkinson's disease, there is something else also added. Rigidity, stiffness. It is like a wood. So when you enter into the clinic, it will take few minutes to come to my seat. So there is slowness of movement, stiffness, rigidity. You can see the face, it is like a mask-like faces. As you put a mask, that means there won't be any expression at all, rigid face, excessive salivation will be there. And because the tremor affects the tongue, there is a speech will disturb, monotonous speech, that was this. The syllabus won't be separated. So monotonous speech, rigidity, stiffness, and look forward, and very, very slow, shuffling gait. As if you walk by a child, நீங்கள் குழந்தை பார்த்தீங்கன்னா மெதுவாக தச்சு நடக்கும். அது மாதிரி தான் வெரிசாக நடப்பாங்க. At a glance, I can make a diagnosis without asking any questions. Slow, shuffling gait. It's very stiffness. When you ask to take, he will take the whole body only. He won't turn just like that. Very stiffness, rigidity, and that tremor. So they're all very important things. Just imagine which is the most difficult form in old age is it is not the poverty, it is not the disease, it is not the loneliness, it is not the lack of relationship. The most serious disability is the dependency. The மற்றவர்களை சார்ந்திருக்க வேண்டிய ஒரு கட்டாய நிலை. Dependency. You are independent, you are okay, you are happy. Even the family members, they like you very much. Once you become dependent, even the whole family members, they try to hurt you indirectly. So if you are independent, you are happy. But in Parkinson's disease, the disability is more common. Just imagine an example telling a man severe Parkinson's disease, tremor, rigidity, stiffness, he cannot walk. He was sitting in a chair. In front of there is a water outside. He wants to drink water. He cannot shout because there is a voice is low and monotonous. He cannot write because of the tremor. So only the tears will be there in his eyes. After seeing that, somebody will go and ask, do you want water? He say yes. Imagine that situation, it goes for years together. It is worth not living, it is want to even go over, die. So this situation, you are independent, active, you are very happy. Once you become dependent to somebody else, that the worst person in the life is a dependency. This Parkinson's disease, the number of treatment is available, but one request is make a early diagnosis. Most of the disease in old age is treatable and curable. Only make a early diagnosis. Even the Parkinson's disease is a progressive disease. Oh, thank you very much. This is one of the disability. depending upon his service. So, any disease in old age treatable and preventable, only make it earlier. So, Parkinson's disease, number of drugs are available. It is a progressive disease. Many people ask me, sir, can we cure the Parkinson's disease? We cannot cure, but we can control. So, kindly remember, when the tremor comes in old age, when your father, grandfather, immediately find out. In doubt, please take it to geriatrician, find out. The essential tremor, very simple, it won't affect your quality of life. If it is Parkinson's tremor, it is horrible. This is first commonly we see. Next is, everybody should know about the dementia. You know dementia? Memory loss due to the disease. Memory loss due to aging is not a dementia. It is a functional dementia or aging dementia. Dementia is a one very, very common nowadays. Age of 50, 60, dementia is not a genetic disorder, but still 10% of people have a genetic history there. Father, grandfather have some sort of dementia, then you are also likely to develop that. If you have head injury in the younger age group, you have more chance to develop dementia. So that's important. What the presentation is, memory on, even Rajan quoted, that is early loss of memory were the recent events. Loss of memory for recent event. Remote memory will be well preserved. He will remember everything. At the time of retirement, when he was all schooling, then college, everything he will remember. But recently, short before few minutes back, the daughter gave a cup of coffee. The old man drank the coffee. Then he will call his son. Since morning, nobody is caring, but nobody is giving any cup of coffee. Already the relation between the daughter and the mother, but it is a very worse situation. So, memory loss is there, but only for recent events. So, they will forget everything, but past event they will remember very much. So, this is a very important clue for you to differentiate these loss of memory due to the aging or loss of memory due to the dementia. Very clearly you can find it from, just ask them one or two questions, they find it difficult. But remote ask them last few years back, they will tell everything very clearly. It is still, we don't know. Dementia is into two types of dementia. One is must be knowing of the Alzheimer's dementia. They call the AD, Alzheimer's dementia, where there is acetylcholine enzyme in the brain that is supposed to activate the nerve centers. But once the acetylcholine enzyme getting reduced, the brain function is poor and they are getting atrophy. The brain starts shrinking. This is very common in Western countries, and there is no cure. There is no cure for Alzheimer's dementia. But luckily, fortunately, we are having very less percentage. We are having mixed dementia. Or 70% Alzheimer or 30 to 40% is vascular dementia. High blood pressure, diabetes, that they have. This is to some extent treatable. But AD, Alzheimer's dementia, is not treatable. Very common in the Western countries. In our country, commonly see a vascular dementia. So AD is still nobody knows. It can come any type of people, whether rich or poor, whether educated or not educated. Even President Donald Reagan got the Alzheimer's dementia. Muhammad Ali fighter, he got the Alzheimer's dementia. Anybody can be affected. So we don't know the reason, we don't know the cause. So how in our country, what I am saying is, Alzheimer's dementia is little less. But other dementia, that is what you call vascular dementia, due to high blood pressure, diabetes, or myxedema, or alcoholism, or brain tumor, they are all treatable dementias. We can be treated. How they present is, first, early beginning is very difficult to diagnose early dementia case, because symptoms of early dementia, symptoms of old age is more or less same only. Very difficult. Memory loss, 70 years, these are normal. It is early dementia, but for him it is a normal. So very difficult. So once he started memory loss, then he will forget everything, slowly increasing. Then he don't identify which is the bathroom, which is the dining hall. He will go to the bathroom, take his lunch and dinner there, or he will go to the restroom, he started eating like. So he cannot identify which room that. He cannot identify the persons. He cannot tell what he, suppose he want to go to Madurai, Meenakshi Amman temple, he cannot say exactly, I want to go to southern side, there is one temple is there, I want to go to, that's all he can say. So very difficult. And also, the physical movements will be very much affected. He will have a brush, he will have toothpaste, he will put in his tongue, he won't brush it. There is no command from the brain to his hand for the movements. The only wife will tell, oh, you are keeping like this for so many times, just keep it, then you will brush it. So these are all different type of presentation of dementia. So slowly it will increasing, then it is what we say, mentally he is dead and physically alive. அது மனதளவில் குழந்தைகளாக இருந்தாலும் உடலளவில் உடலளவில் மனிதர்களாக இருந்தாலும் மனதளவில் குழந்தைகள் physically alive, mentally dead. This is a picture, just imagine your father, grandfather, physically is perfect, but mentally is demented totally. So slowly increasing, then a lot of fall, infection. Once the patient come to me clinic with the relatives, I pity on the relatives, but he is a happy dement. He don't know what things are going on. He will forget everything. So he is not affected. He is not sufferer. But sufferer is the caregivers. I really pity on the caregivers. I spend most of times how to look out. Just treat him like a child. Don't argue with him. Don't teach. If you cannot understand what he is, only you are wasting your time. I will simply pathetic for the LLP. So, how to make early diagnosis? So, we have one scale that MOCA test, Montreal Cognitive Impairment Test, is available in the States. We are doing in my clinic. When the patient comes, we know BP, we can find out from the apparatus. Sugar, we can do the blood test. But memory loss, how to assess? There must be a scale. So, there is a scale in my clinic. Everybody is available. About 30 marks. We ask a number of questions. What is the date of birth? What is your married life? When did you qualify? They would come. If out of 30 we get 25 and above, okay. Your memory loss is not a demented, okay. If you get 20 and below, there is early dementia, 15 minutes, severe dementia. We will prepare a scale. I will confirm the diagnosis. Once you confirm the diagnosis, make a cause for that. Okay, he is demented. Now what is the cause? Then I go for MRI scan, then I go for all the blood tests. Any tumor is there or any vascular, we will give the treatment accordingly. So, our object is how to make a early diagnosis. Very, very important example. It happens 15 years back in my clinic. One Brahmin lady, mommy, her husband is retired, some bank employer, very disciplined person, 60, 70 years, daily